let's jump now into our last panel session of this forum. Will be chaired by, please, a warm applause to Rim Ayadi, President of the European Mediterranean Economists Association. Thank you very much, Rim. And we have here too, it's Tiago Zibecchi, economist and full-time researcher at Euro-Mediterranean Economists Association. And also, just right there, Marta Bret, director at WeMind Cluster. But on the other hand, we will have 3 other panelists just joining us virtually. Here they are. One hand, Eyre, Senior Fellow at Meadows Mental Health Policy Institute. Paweł, Świeboda, founder and director of NeuroCentury and Senior Fellow at the European Policy Center. And Marta, Mohwinckel, Senior Pharma, Biotech and Health Tech Executive and Advisor. An applause for the three of them. So, Ms. Ayadi, whenever you want, the floor and Zoom is all yours.
Yes, thank you very much. This is, first of all, it's the end of the day. I know that everybody is kind of tired. I guess this is normal that we started today at almost 9:30 and I gave the keynote speech, so I am the most tired of all, but it's really a great pleasure to have this panel discussion, and I see my friends and colleagues on screen to discuss toward brain economy in Spain. This is a great momentum because we have been discussing this since, I don't know, Harris, maybe 4 years already, when Harris Eyre came with the idea from the neuroscience perspective, thinking that we need to coordinate our actions with economics and policy and have this idea of neuroscience really introduced in the all economic policy thinking to engage our economies in a transformative manner. But also, this quite momentum because we have been able to agree together with definition, brain capital definition that was many years ago already, and now we have launched the Brain Economy Hub together with the colleagues, and this is also very, very interesting. So I think we talked this morning about the societal challenges and how we need to have innovative policy thinking to allow us to dive and to transform our societies into more well-being, more engagement of the individuals to ensure that their, in a way, their life and their health, it's in their hands. So in a way, this is also a proactive way to ensure that we reduce the mental disorders. Brain health is not only about a cost, it's also our investments as individuals, as society, as economy, to ensure that this is a brain capital is an asset that will bring value over time to our economies and societies. So in reality, we move into a regenerative thinking. And this is the point I made this morning, that we need to think beyond the box, outside the box, and try really to think in a regenerative way to enhance our economic thinking, economic models that come beyond this. So today we have, as you can see, a number of speakers, panelists, and I would like to start with Harris. Harris has been the leader of this concept of brain capital and brain economy, and we developed the Brain Capital Alliance, and now the Brain Economy Hub. So Harris, he is a neuroscientist, first of all, and he is a lead and senior fellow at Neuropolicy, the Rice University Baker Institute for Public Policy in the US. He is a member of the advisory board of the Euro-Mediterranean Economists Association and the executive director of the Brain Capital Alliance. So Harris, the floor is yours, and towards a Spanish brain economy, please.
Wonderful. Thank you so much, Rim. I'm glad to be with you all today, and I say hello from the west coast of the United States today. And I want to further dig a bit deeper into some of the points that Michael mentioned in his wonderful keynote, to give you some maybe a little bit more of the philosophy and thesis of the brain economy, and then some practical frameworks that I hope we could start to apply in the context of Spain. I'm a very proud advisor to EMEA, the think tank that Rim is the founder and president of, and that Tiago works with. And so I come to Barcelona very regularly. And anyway, glad to be, as you could say, a wingman of the Spanish context if we want to take this forward. Okay, so the first point to say is that our brains are not doing so well. As Michael mentioned in some of his slides, the cost and prevalence and economic burden of mental and neurological disorders. So our brains are in the red in financial terms, right as we need them in the black, right when the modern world demands much more of our brains in terms of our ability to integrate novel technologies and information and deal with different types of shocks, political shocks, technological shocks, climate shocks. So simple way of describing it is that our brains are in the red right when we need them in the black. And this was a wonderful distillation of the brain economy from the chair of the Greater Houston Partnership, the Houston Chamber of Commerce in Houston, Texas. So thank you to Eric. So the cost of mental and neurological disorders, Michael outlined. I'm just going to make a brief note here in addition to say, you know, it's really significant. It's 2.1 trillion to the global economy every year, including healthcare costs and lost productivity costs. And this is for all mental and neurological conditions across the lifespan. So autism to Alzheimer's disease. This is 2/3 of the Indian gross national product. And it's more than the US spends on defense every year. Very big number. So this is perhaps at the scale of climate change related cost economically and humanity-wise. As Rim mentioned, we're trying to sort of propose a shift in thinking. Brain health is an asset to governments. It is not a cost. We need to think about asset-based thinking. And this is work that is being done very nicely in the United Kingdom context. It's being pushed by IPPR and the Tony Blair Institute, where they're thinking very much like this. So I just encourage you we need to try to get out of just thinking about deficits and fixing deficits, but let's think about actual assets and building strengths of our brain. We believe that that's very important to really change the narrative around brain health. So the World Economic Forum did a big survey of business leaders around the world and came up with key skills in the workplace. Skills are essential to being successful in the world of work and successful to propel businesses. And this is very important in the European context, as Mario Draghi has been promoting the importance of competitiveness. So the skills of competitiveness, the top three are analytical thinking, creative thinking, and then non-cognitive is the third: resilience, flexibility, and agility. So we must have these skills, demand these skills, push ourselves and our co-workers to try to cultivate these skills. But to have these skills, we also need brain health, of course. And this gets to brain capital. Brain capital is therefore the integration of brain health and brain skills. So you can see with brain capital, we bring together health, education, and labor market and workforce components. So this then takes us to this brain economy transformation, where we're saying that the current economic and societal model is brain negative. It's depleting our brain capital, and we must transition to a brain positive state, which is stopping and reversing the loss of brain capital and building it. And we need to do that in all sectors: in health, in social, in aging, in early childhood, in industry, and climate. So this is a whole of economy mobilization So we call it the brain positive economic transformation, or just the brain economy in short. It's obviously, as I said before, brain health is the bedrock of this economic transformation, and to build the other economic transformations that we know are important in Europe: green transition, digital transition, care transition, bioeconomy transition. They're all sort of sitting on top of the base framework of the brain transition. And we just published this paper a couple of weeks ago. If anyone's interested, you can check it out. We argue that brain health is essential for these other economic transitions to be smooth. We don't want to fail in these other transitions halfway, and then that maybe, you know, they fail, they go static, or they backslide. We need to keep these transitions happening very smoothly. Paweł and I articulated the brain economy and how it's important for Europe's growth in the context of the Mario Draghi report, who's the former president of the European Central Bank. We published this paper last week in the in the EPC, European Policy Center, so you can check that out if it interests you. Tiago will talk much more shortly about our brain capital dashboard, which is our approach to measuring brain capital. This is global. It would be nice to consider doing this just in the context of Spain to get much more granularity in the subnational, regional, local context of Spain. So that's a potential methodology we could consider. We've also just launched a brain economy systems change lab, which is an approach to looking at key shifts we want to see in each sector, and then targets and indicators to measure those shifts. This is again global, so it would be nice to localize this methodology just to Spain. And maybe it's, you know, all of Spain, maybe it's just one part of Spain, maybe it's Catalonia, for example. We just got back this week from a great meeting in Luxembourg. Paweł was there as well, where we were exploring with the European Investment Bank Institute, how do you systemically invest in the brain economy in Europe? And one of Michael Morley's colleagues, Kana Enomoto from McKinsey, was there too. This is all about how do you look at different types of ways of investing in the brain economy: equity investing, debt investing, looking at investing in health and skills, in infrastructure, digital, diagnostic, drugs, et cetera, et cetera. So it's really a very broad view of this, and looking at not just market rate returns, but also concessional returns. We will have a report that we will publish in the coming months about this, but could be useful given, of course, Spain is part of the remit of the EIB. I think actually a former Spanish politician is the president of the EIB. So watch this space. Our global engagement is accelerating, which is terrific. We're working with folks all across Europe, NGOs, think tanks, universities, governments. We're also working in the global south in the context of Africa, Latin America. And so here's just some examples of some of the writing and dialogues and activities that we have around the world. I want to finally say, before I conclude, that we are developing now new educational opportunities around the brain economy. We have a leadership executive education course that we're running through Rice University's Global Institute. It's in Paris. So if you're interested, reach out to me. It'll be a 4-day executive education course, April 7th to 10th next year. We'll go over all the different components of the brain economy and ultimately how is it relevant to your organization or your context. And we have some wonderful confirmed speakers, including Rim and Paweł in there as well. So we'll be announcing this publicly shortly. So in conclusion, we do need a new approach to global economic leadership and to national economic leadership. Maybe the brain economy is that model. And as you think about this session we're having now, how do we develop a shared vision and mission in Spain? How do we identify and engage champions? I'm sure many of the champions are in the room. How do we align existing initiatives across the gamut of what is possible? Do we develop a dashboard, a systems change lab? How do we pilot? And then how do we monitor and evaluate? So thank you very much. And I look forward to hearing from the rest of the panelists in the discussion.
Yes, now yes. Thank you, Harris, for this great setting. And one speaker this morning said that the societal challenges are global, and the transformative approaches must be most probably local. And this is what we're trying to do, really. Our initiative, the Brain Capital Alliance and the Brain Economy Hub, is global, and we're trying to push this, in a way, movement as quick as possible. But then the transformation must be country-based and must be local as much as possible. So with this, I would like to introduce Paweł Świeboda. He is the founder of NeuroCentury. He's also a member of the advisory board of the Euro-Mediterranean Economists Association, and he is the co-founder also of the Brain Capital Alliance. So Paweł, how can we leverage on innovation and technology, and what does it mean in terms of the brain capital? Please.
Thank you very much, Rim, and many thanks for having us today. I'm also a great admirer of the innovative capacity of Barcelona, and I can tell you it really resonates across Europe and beyond. And I'm also a proud advisor to EMEA, which is a fantastic organization. So I would like to focus on neurotechnology, AI, and digital health innovation, because this is what really will drive this development of brain capital that Harris just outlined. And here we go. And we have to understand at the outset that technology is a key enabler of understanding the brain. And this is all very, very fresh. I worked for a few years running one of Europe's largest scientific projects in the area of brain research. And we had scientists in the team who remembered working with single neurons. And there is nothing wrong with working with single neurons, but they did so because it was not possible to do anything else. Now, technology has enabled scientists to work with populations of millions of neurons at the same time in different locations of the brain. So this is truly phenomenal. And it's phenomenal because the brain is one of the most complex data systems that exist. There is a stark similarity between the brain and the universe, in fact. Even the numbers sort of match. 86 billion neurons, as many glial cells, with galaxy having about 100 million stars, and 100 billion stars. Fibers in the brain, 2 to 3 million kilometers. Diameter of the sun is 1.4 million kilometers. So I don't know, but nature must have had something in mind when it went about constructing the universe and then the brain as well. So we have seen in the past few years radical progress in our ability to read from the brain, but also write into the brain. And there are really breakthrough advances in electronics and in computational. One example to give today is that of a NeuroPixel, a device which is really developed on the back of silicon technology. It's wafer thin. It allows you to study neuronal activity with great precision and across much of the brain. Ultrasound technology is also improving radically, and it helps to study the brain in a minimally invasive way, which is, of course, important. Neurotechnology matters because there are some conditions of the brain which you cannot address in any other way than through a neurotechnological approach. Just because the road is blocked, that's the metaphor one needs to think about. And neurotech has already seen quite remarkable success. The cochlear implant, which helps hundreds of thousands around the world to hear better, including children who would not otherwise be able to learn properly. That is a neurotech device. Deep brain stimulation is also spreading. It's used for treatment in Parkinson's disease, but also in depression. And we have amazing scientists now working on the spinal cord implants. In fact, the EPFL team in Lausanne has this through the clinical trials, and it is amazing to enable a paralyzed person to walk again in 24 hours through a spinal cord implant. Also, the visual prosthesis will help addressing the problem of the lack of sight. So quite significant possibilities here. And neurotech is interesting because these solutions go directly to the target. So unlike a molecule that affects broader regions of the brain, neurotech addresses something very specific. And you can also have personalized treatments that address the relevant problem. And these neurotechnology solutions can affect different conditions of the brain as well, as I mentioned. AI is enormously important in all of this for the simple reason I started off with, namely, the brain is the most complex, or one of the most complex data systems, and therefore AI needs to help to extract value from data. And it is happening. It is happening as we speak in terms of AI solutions which will be used in administering Alzheimer treatments, which are slowly emerging. It's early days, but monoclonal antibodies are now hopefully beginning a new wave of innovation in Alzheimer treatment. So far, they are not maybe super effective yet, but again, the hopes are high. And you need to monitor patients. You need to send them to have brain scans. And AI will help to make that process much more effective. So Icometrics is a Belgian startup which has just seen an FDA-approved AI solution to analyze so-called amyloid-related imaging abnormalities, so abnormalities which take place in the brain of some individuals and which need to be identified before the Alzheimer treatment is offered. So as we can see, it's all connected and AI can play a very important role. But neurotechnology is one thing. I think we need to think much more broadly about how digital means can be applied in brain health. And I believe that we will see very soon the emergence of a comprehensive brain health assessment systems and brain health tracking. This is the missing link to a large extent. We have very little consistency in how brain health data is evaluated, monitored, and treated. So if we were to have a platform enabling this, then we could stratify patients according to risk. And we could anticipate the progression of pathology much better, with the possibility of applying interventions that are able to reduce risk. For all this to happen, we need the innovators to come together, and they can most profitably come together and most beneficially if they form a platform and share some of their research and some of the findings and innovations in the pre-competitive space. This is what is meant by the idea of European Neurotechnology Medicine Platform, where innovation in electronics and computation would be, but also with respect to coding of the devices in the body, things like that would be shared before people go to the market. And this would then enable a much faster progress of innovation. So I will finish by saying that all this really contributes in a sizable way to this brain positive transition that Harris mentioned, because we need a life cycle approach to brain health, an approach that really starts with neurodevelopment in early years and goes all the way towards the late years of life when the prevalence of brain disorders is highest. We also know much more about the determinants of brain health, and we know more about modifiable risk factors. In fact, the list of modifiable risk factors for most brain disorders keeps on going up and up. Lancet Commission is perhaps the most well-known point of reference with respect to dementia, and it just published its update of modifiable risk factors with 2 new additional ones added. And the list includes now 14 different risk factors, with the conclusion that 45% of the disease can be prevented. So this is an enormous potential for preventive medicine, and that is one of the most fundamental contributions to this brain positive transition. On the positive note, I think all of us take much more interest in the brain and take much more interest in our cognitive, emotional, and social abilities. And this, I believe, takes us directly to the age of cognitive welfare and brain capital that will be with us for time to come. Thank you so much, Rim.
Thank you, Paweł. And thank you also for making a reference to the non-health determinants of brain health that we can act upon. And there has been many references today on how we can proactively manage our health conditions via lifestyle changes. So this is also important, and it depends on everybody. So after leveraging science, innovation, and technology, I would like to invite Marco Mohwinckel. He's the president of Tech2, and he's an executive and advisor to biotech, health companies, and many other. I met Marco a couple of years ago in the Tech Tour, also in Lisbon. And it's so interesting, all the technologies and the innovation that we can see there. Marco, how do you see the investment roadmap strategies that are, in fact, possibly required for enhancing the growth of the brain economy, for example, in the context of Europe, in the context of your experience, and also potentially in Spain?
Thank you, Rim. Can you hear me well?
Yes.
Okay, great. Well, first of all, thank you so much for inviting me to be part of this. I'm excited about seeing so much, let's say, engagement by all of you, and hopefully we can really continue growing this movement. Because indeed, all the challenges, I think, are very clear, and the burden that we're facing is growing. The burden of disease, in mental and brain health in particular. We are facing still, I think, a lot of a problem of understanding, a problem of stigma, a problem of access and affordability. And I think Michael mentioned also the problem of scaling solutions. And I think it really takes a village, and we all need to collaborate. So I appreciate all this. Look, I mean, I'm a man of action. I'm quite pragmatic about this. I've spent 25 years in companies, large and small. I advised companies. I was an executive in pharma and in biotech. I've been on the investment side as well. So I think time and again, all the things that Paweł mentioned are really exciting, right? So we have a lot of technology that is coming and that we can leverage to address all the challenges that we said: access, affordability, better measurement. I mean, we're living in exciting times. It can be overwhelming, though, and we need to really appreciate that innovation comes from universities, from researchers, and from entrepreneurs. And innovation needs to be financed, and it needs to be invested in. And everybody and governments need to create the right incentive schemes and frameworks for that investment to accelerate. So all this, so we really need to work together on this. If I take the perspective of investors, and by that I mean in early stage companies, and by that I mean venture capitalists, it is really important that we create opportunities for venture capitalists and entrepreneurs to come together on a regular basis. And in that sense, I am trying to give my contribution to it by stimulating that ecosystem in partnership with Tech2. Tech2 is one of the largest entrepreneurial communities in Europe. It organizes over 25 events a year. It has a tribe. It's been around for 25 years. It screens over 1,000 companies every year, and it's just a great platform for investors to meet entrepreneurs. And for investors to focus on the most promising emerging technologies. And in that sense, we have decided to apply this model to brain and mental health. And we did launch a program, an investment program, which culminated in an investment event in Lisbon earlier this year that was very well attended and very well received as well. So we want to do more of this. We want to create or recreate an event. I'm pleased to say that we have started talking to Barcelona and partners, to WeMind, to Marta, to RIM, on how to, and to local investors, on how to bring these investments, these investors, the international investors, to the region, how to highlight the great innovation coming out of the regional and local ecosystem, and also do that not only in Barcelona and in Catalonia, but do it in other hubs across Europe and the US, because I really believe that when it comes to scaling, I've seen too many good companies and too many big technologies simply not being able to make it and staying, lingering and eventually dying because sales cycles are too long, because business models are not clear, because they don't have sufficient funding or access, to potential stakeholders. So I believe that by creating hubs, across Europe and the US, tapping into existing stakeholder hubs, not recreating or reinventing the wheel, but connecting these hubs and showing how companies from one region can and make it easier for companies from one region to move into another region is of essence. So I'm very excited about doing this together with continue to land some program and some in Barcelona next year, and do that in partnership with you, Rim and Marta and others. But I guess what I want to stress again is it's. We live in capital is abundant. Okay? I don't think capital is scarce. It's a scarce resource. And there's a lot of great ideas and great companies, and we just need to have a mechanism to pick winners, to support winners in scaling their innovation, and we need to make sure that we do it together. So. I'm committed to this. From my perspective, I want to attract. I have some objectives for next year to set up these hubs in across Europe, and to make sure that we have an investment program in Barcelona and in the region and in other hubs across Europe as well. For me, if I just may add one more problem that I see is the lack of incentives. Okay, so we need to have governments also to step in and provide incentives, and I think innovative financing models and public-private partnerships are essential in my view. Because I really believe venture capitalists can support startups and private equity companies can help with the scale up. But the investment cycles are not aligning well with the time and the time it takes to scale companies in healthcare. And time and again, we see that we need to have more patient capital and more of a mid to long-term perspective. And in that sense, I appreciate and welcome public-private partnerships. I welcome innovative financing mechanisms, be it in the form of bonds, like we have seen applied to other societal and big issues like transition to the green economy, green bonds, or I think Rim and others can talk quite extensively about how to set this up, and it's good to see that the European Investment Bank is also stepping in and wanting to structure, let's say, or at least initiate a dialogue to support financially the private sector and entrepreneurs with a mid to long-term perspective. So with that, I hand over to you, and I'm more than happy to take any questions that you may have. But again, thank you very for organizing this, and I really look forward to working with the rest of ecosystem to take the investment program that Sector is organizing to the region, and maybe take it also beyond into other hubs that you have on your agenda.
Thank you, Marco. I have one question for you, since I listened, to you, is about the, is there a space for impact investment and then venture philanthropy?
Yeah, I mean, Rim, I think you're ideally positioned to answer that question. So I obviously think that impact investing is important. So investments, and it ties to just what I just said. I mean, it's not only about return on an investment for over the 5 to 7 year window, which is typically, or let's say in the case of venture capital, it may be a bit longer. But the reality is that it's not about financial return. It's about only. Of course, it needs to be sustainable capital, and it's the nature of capitalism that returns on investments are of essence. But we do need to start measuring impact, and impact is hard to measure. We need to measure output. We need to measure outcomes, as you know. We need to be clear about the metrics. And so venture philanthropy, of course, I'm all for it. I think there's a lot of family offices out there or ultra high net worth individuals that are very willing to take a very long-term perspective. And we totally need to lean on that longer-term, more patient capital. So yes, is the short answer. But we need to return on the investors, on the investment as well as measuring better and finding tools to measure. Right? I think we will probably talk a little bit about that in the next presentation, or in one of the next presentations. But what are we measuring, right? And how are we measuring? And can we align on a set of metrics that we all consider as a priority? When we talk about brain health, when we talk about mental health, we talk about a lot, right? And particularly if we open and broaden the conversation to include all sorts of social and economic and health determinants, then we just need to. It's easy to get overwhelmed. Okay, so my advice here is to try to think holistic, but to be pragmatic, and let's also make a big effort in simplifying it and making it easier. For people to understand what are we aiming at and how are we going to measure, because we cannot pretend to improve something that we are unable to measure. Okay, so hopefully in our next conversation somebody can pick on that point, and maybe dashboards are a good way to start.
Thank you for mentioning the role of data measuring, because without measuring, it's even more difficult to have some policy actions and less to invest. So yes, we need to measure. And I want to give just a history about this measuring the brain capital. At the beginning, we were much more ambitious. We wanted to construct a brain capital index. And then we fell back into a dashboard because we couldn't find data that allows us to measure, in fact, the brain capital as one number. And then we said, okay, probably it's good to go further and collect the data that is available. And this is why the role of data has been so important in really defining what type of investment we want to do, and at the same time to understand the phenomena, and particularly this phenomena that connects to brain health and brain skills. So then when we started with brain health, we only found certain data on absence of disorder, and that's what really the sector has been practically collecting to assess the importance of the problem and then how much it costs to the countries, to the governments. But then there are other aspects, which is the brain skills. But unfortunately, all those brain skills that are connected to emotional intelligence, creativity, resilience, adaptability, and so on, there is no data about it. So we only have data on specific skills for the job market, and this is not enough. With this, I would like to introduce my colleague to my right-hand side, Tiago Zibecchi. Tiago, he's a researcher at the Euro-Mediterranean Economists Association, and he's working on the dashboard together with Harris and the team. So the history of that dashboard, it's quite impressive because we started as a working group under the Brain Capital Alliance, and then slowly we collected the data. We agreed on certain indicators that were important for defining the brain capital. So there is a lot of work behind that. It's not only data collection without saying something, but then it's really based on expertise judgment that we have been trying to collect over the years. And also, I want to say that this interaction between different disciplines, the multidisciplinarities, is so essential if we want to develop this brain economy. So this is not only about, I would say, policy or finance or economics, but really we need to get into the science to allow us to understand what are the interactions of the brain and so on. Tiago.
Thank you. Well, thank you, Rim. Thanks also to WeMind and all the organizers for setting up this event. It's a great honor and pleasure to be here at the panel today. So as part of my contribution, as Rim already said, I'm going to be focusing on the importance of data in promoting, upscaling, and implementing the brain economy transition. So after all, if we are really serious about moving away from a brain-negative, toxic society and economy into a brain-positive one, then we must find a way to track and to measure this in a transparent and a holistic way. So, and I guess especially after yesterday's session on digital transformation, data, and AI, I don't think I need to spend much time trying to convince any of you about the value of data and the value of a data-driven approach, especially if we are trying to show credibility to stakeholders, if we're trying to attract investment, if we are trying to connect with research to academia, and also if we try to convince policymakers. So my plan for the next 8 minutes is to provide first an overview of the Global Brain Capital Dashboard, and then I would like to share a little bit of how we are working to refine our methodology. So how we are trying to integrate the Systems Change Lab, how we're trying to also work with more granular and spatial data to have more regional metrics, and also how we are trying to connect the brain capital to ESG framework, because this is very important, as Marco was saying, to fill this financing gap with the private sector, with philanthropy. And finally, if I have time, luckily, I'll also propose a list of challenges and opportunities for the future of brain capital. So as Harris and Rim already said, the Global Brain Capital Dashboard exists under these three main pillars: the brain health, brain skills, and brain capital drivers. So what you see here is our interactive map. So we have national data, cross-country analysis. And as Rim said, our team of researchers, we have compiled more than 60 indicators on 30 years of public available data. So this data comes from sources like the WHO, OECD, World Bank, UN, FAO, and so many others. And I guess this is the first objective of the dashboard, really to have this unique framework to compile all this public data to make it more accessible to anyone to really have contact to it. And then consequently, the second objective of the dashboard that I believe is that we would like to propose an alternative way to measure well-being. So a way that we are incorporating brain health, brain skills into the core of economic growth, to the core of economic policy and prosperity. So as Rim said, and I'm reinforcing here, not to treat it as a cost, but really as a main core and objective of our policies. And good, this is really the groundwork, the base of the dashboard. But then now, the question that we would like to raise is, okay, we have this data, we have cross-country data, but really, how can we trigger action from that? So this is exactly why we are building the Brain Economy Lab. And this is where I would like to connect to what Harry said about the systems change approach, because really, there's no silver bullet. We need systematic action and systematic change. So we are developing this new tracking panel where we're going to have a time series, so a trend for countries. This example is from Spain, and the indicator is death rate from air pollution. So we can see here how Spain is actually going the right direction to decrease death rate from air pollution. And let's say that specialists, they have identified this threshold of reaching less than, 5 deaths per 100,000 people. And we can see that, well, our projections are showing that Spain goes in the right direction. And we would like to have this for all sectors, not only for countries. And in fact, we are being inspired by the Systems Change Lab, and they have been doing this for Nature Capital already. So for example, here, I have selected the forest and land sector, and the benchmark they are working with is if they want to reach, we want to reach Earth. We want to reach Earth average temperature to be below 1.5 in 2030 and 2035. So they have selected several actions, several indicators they have, for example, deforestation. And they know that in 2023, we have 5 million of hectares per year being deforested. So what do we need to do to reach the benchmark of to stay below 1.5 Celsius in 2030? So we need to reduce this number that we have today by 65%. And then 2035 by 72%. So see how here we have much more practical measurements on how we can reach goals and targets, right? So we'd like to do this for Brain Capital as well. And so far, we have been talking about country data. We have been talking about sectors. But what about the differences in regional differences, for example, in Spain? What about Catalonia? What about Barcelona? So this is why we are also working into incorporating spatial and granular data to have much better information, because so far we know that Spain is going to this direction, but we don't know how Barcelona is going, and how Madrid, and how La Coruña, and so on. So for that, we are exploring sentiment analysis data. For example, we can create machine learning and use AI to collect information from journals, from media, and from Google. And this gives us real-time data. Also explore satellite data, for example, what we have on the left. This is actually what GigaMaps do, and here is an example of global school connectivity. So each one of these small blue dots are schools, and these are real-time data. They are able to use with satellite, they're able to see how many schools are in Barcelona, and how well is their Wi-Fi, for example. And this is going to give us much richer maps. It's going to give us this regional scope that we want to take regional solutions, right? And evaluate regional policies. And then the third point that I would like to raise is really we need to link the Global Brain Capital Dashboard to the ESG framework to cut this financing gap on brain positive initiatives. So let's say an investor wants to fund an organization here in Barcelona that it's a brain positive organization, but how they really show credibility that they are creating this impact for brain health, mental health. So this is why it's important to have also corporate level and how we can show to investors that organizations, initiatives, NGOs are creating brain health positive impact, right? And well, the last point that I would like to mention, maybe we can leave this also to the discussions, but really we have identified some of the challenges and opportunities about the systematic approach, about data. A lot have been discussed already yesterday when we were talking about, for example, privacy and ethical concerns. I remember a presentation that most of the data that we have are coming from very few companies, Microsoft and so on. So we know that there are challenges to get this granular data. We also know that there's a lack of data standardization across sectors. So each sector works differently. And as well as Rim said before, it's really hard to come up with an index, right? Brain capital has so many arms that it's really hard to come with one index, one number to really evaluate. So these are some of the, and also complexity on identifying those benchmarks. It's not easy to sit down with all specialists and to make them really define those targets and thresholds. But well, on the good side, I believe that the dashboard and the systematic approach also would spike collaboration between governments, financial institutions, academia, also in a way to refine our dashboards, build this investor confidence that I'm saying, and most importantly, really to place mental health and brain skills as a core objective of economic policy and growth strategies, beyond GDP, for example, beyond just mere GDP-centric indicators. So with that, I really finish my contribution, and well, I'm open to questions for the rest of the panel. Thank you.
Thank you very much, Tiago, to give us this approach on the need for data. And of course, what is also important is the evolution of this data. So I always say that it's important to have absolute values, but then what is more interesting is to assess the values over time and see if there are any breaks in the data, the series, and then try to understand why there have been some breaks with explanation of this data and trends. So trends is very important too. And then what you're saying about the targets is so essential, because then we can assess how things evolve over time. So, but beyond data also, and I would like now to invite Marta Sanchez-Bret, who is the CEO of the WeMind and a partner of EMEA, to talk about the role of clusters. And this is so important, because this is where the private-public partnership is really operationalized, and at the same time where you can detect experiences that can be upscaled and that can be really taken forward with this approach that we talked a lot about. Yes. And I was so excited when I met Marta, I don't know how many, 1 year ago?
3 years.
3 years ago. And we've been talking about it, and I said, this is really amazing, because, you know, it really is a center of the transformation. Exactly. This is what we would like to see. It's not only one actor, one stakeholder, but you have this multi-stakeholder approach that allows really for a collective change and a transformation from all sides. Please, to you.
Thank you. Thank you, Rim. Well, thank you, everybody on the EMEA, on Baker Institute Policy, to Paweł as well, and to Marco, to be present today, organized by Rim. I would like to, first of all, be very short, because I understand that it's like 2 days that you all have been presenting many data, many concepts, conclusions, challenges to you as well, Michael. I mean, I could not be better than you doing this. So first of all, I think everything on that side has been very clearly detailed. I would like to start talking about our story. I mean, when I was starting at the cluster of mental health in Catalonia like 10 years ago, to me that doesn't mean really something, I mean, it's something that was challenging me in terms of what do I need to do with this association? What do they want to do as a sector? Mental health to me was very unknown. I was coming from industrial and technology market, so I didn't know anything about mental health. And they said, no, but this is good because you will introduce like a kind of new view, not really focus on what these complex ecosystems are working and the professionals with these biases. And maybe you can add something, so I decided to try. And with this story, I started working with Joan Martí, that has been with today this morning, talking about clusters and competitiveness and employability and economic action. I said, I'm talking mainly to psychiatric people, talking to policymakers, I'm talking to general managers for hospitals. We didn't have the economy, the competitiveness, and innovation on our table at that moment being, because mainly here in Catalonia and in Spain as well, 90% of the mental health care is public. So that means that where we can place competitiveness, employability, talent, et cetera, but we decide to put our effort on it. To me, I think it's one key point that you had mentioned this afternoon, is that really the brain is key and is an asset. And on this hypothesis, I decided to tackle the challenge and to start working with a lot of professionals, with a lot of people that for sure know a lot about care, about assistance, about processes, about products, about pharma. And we decide to start trying to figuring out how to introduce this innovation into the mental health sector, and how we can create some kind of competitiveness, some kind of employability out of the public, but accompanying the public, trying to build these bridges on public and private, and trying to fill the gap where the needs for the user, for the patients were detected. So having said that and placing this story, I feel really happy when I met you, Rim, and you told me about the brain transition, the brain capital, knowing that in US you were kind of starting to work with this index, no? That were first placed and trying to deal with all this macro data, and that could figure it out that we could change things. So to us as a cluster, as a board, as an ecosystem, for sure the key is, it was and it is nowadays, is the mission is to give the better biopsychosocial assistance and care to those who suffer. So if we put our mission on that, how we can combine competitiveness, employability, and public services. So it was a kind of a mess, but when tracing the brain economy, not only as something that we could work on, for example, as you mentioned, the brain skill set in the labor, or in terms of employability, or in terms of how the consultants use this skill set to place the right people and hire, et cetera, et cetera. So one step further. Let's take this brain skill set as an asset itself. Let's work with the absence of pathology, but at the same time trying to fusion this innovation, these startups, this venture capital into this complex ecosystem on a holistic view, multidisciplinary. I said, wow, this is something that we potentially we can start acting locally, because as Joan Martí has said this morning, we started local, we start growing and growing, but we are still regional. We are working with some other clusters at national level. We had created like kind of federation with Cluster Salud España, which is the next step to work together in collaboration with our colleagues around the peninsula, and as well intercluster with all the clusters that had participated as well in this conference, and during these 2 days they had shared that they are sharing with us the same societal challenges, because longevity, mental health, neuro, quality rights, patient empowerment, everything it's at the agenda of anyone. So that means that we can work locally, we can place the policies, we can place the recommendations globally if we work with dashboards, with data, with your advice, no? So being consistent and evidence-based, I would say, in terms of rigorous data, and we can bring the evidence that this could be really the change that could place together the natural economy and the brain health transition into the right place and the sustainability. I think that this is great. So I've got nothing else to say. We are setting the models together with you. We are acting local. We are being consulted by your advice. And I mean, the complex ecosystem is here. We've got the patient expert voice down there. They are happy to be listened as well. I mean, they do not say, we do not want you to talk about competitiveness, about talent, about employability. We would like to be heard, and that's something that we are putting in our place as well. So to us, and to conclude, understanding our systems, understanding the needs, the preference, and the circumstances of people who use and who need care, understanding the local environments and care and support assets is what we try to provide, understanding as well which types of care and support work best for which people, understanding how to measure outcomes for people who use and provide care as well, so the professionals, the well-being, the dignity, the physical and mental health, understanding factors that can affect the quality, cost, and effectiveness of care, as you mentioned, and how different financing and governance mechanism can enable us thriving integrated community-based care systems. So I think that's, to me, all I have learned during these 2 days together with you. Happy to continue working on that, and that's it.
Thank you very much, Marta. This is great. I don't know how much time I still have, maybe a couple of minutes. I don't know, I look at Ines, she's not, can I have 2 minutes or not? 15, fantastic, okay. So I have 15, or I can extend a bit, or 6, perfect, thank you. So I want to turn to Michael after his speech, and also I had the pleasure to read your report on the workplace, mental health in the workplace, and how to increase productivity and innovation, particularly for example, when you have younger workers, and to really, based on your experience as McKinsey Health Institute, how do you see really, is there a trend to improve the employer strategy vis-a-vis the workers in different sectors? And do you see some disparities, for example, between sectors? And what we need to do to really take into account on a sectoral basis of our economies the importance of mental health, particularly for the young generations or the young workers that are really facing with all these complex societal challenges. So most probably they are in a generation where they have to be much more resilient than, for example, 20 or 30 years ago.
Yeah. Well, wonderful question. And I think in the spirit of a lot of the discussion we've had so far, brain capital is an asset. And I think when you look at companies that are trying to figure out how to kind of more effectively utilize their workers, they're losing out if they're not able to help elevate each person be their best, right? So I think there's a myriad of different activities that we see employers doing. But one is, and I think culturally too, some expectations around the workplace for everyone shifted a little bit coming out of the pandemic. And so there's a little bit of a rebalancing to figure out how to create these positive cultures that are sometimes somewhat hybrid, how to give people the flexibility and space that they need. I think there's a lot of individuals where instead of coming back full-time, they're coming back part-time, they want some of that flexibility. I think there's a lot of focus too on neurodiversity. So if you think of, you know, a lot of employees that might be on the autism spectrum, you have employees that might struggle with depression, like what kind of support can you provide that actually helps them be their best, helps them kind of be proactively be healthier, be more effective. I think we've seen almost every single major employer in the US, the UK, continental Europe, kind of pursue some additional kind of mental health packages through different employee assistance programs. And that's everything from kind of navigation to kind of providing, you know, virtual consultations and things like that. So I would say overall we've seen much more focus from all the mid and larger companies on addressing mental health as a way of reducing absenteeism, improving the effectiveness of their population. I think we've also seen a lot of work in trying to create flexible models where people might need a flexible model instead of being full-time. I think we've seen a lot of focus on how to help people with you know, autism and other groups kind of be more effective. And I think those are a lot of the things that they're trying to use to make sure that they create, well, I think the last thing too is people really care about what they do. They really care about creating a sense of purpose. I think one of the challenging things which employers are wrestling with at the moment is creating these cultures and communities and a sense of purpose in the workplace, while you're also wrestling with somewhat of a hybrid workplace infrastructure and culture. And so I think we also see a lot of employers just be much more intentional in reconnecting and over-communicating to their employees really the sense of impact and the sense of purpose that they're doing. So I think that's huge, but I think it comes back ultimately to the fact that, you know, brain capital is a huge asset, not just at a national level, but obviously at an employer level as well.
Thank you, Michael. I have another question, but feel free not to respond. How do you see the future of social security and social protection?
I wasn't ready for that one. Look, I think there was a panel on stage before I joined on longevity, right? And yes, we're going to live much older. I think that necessitates, as we talk around in MHI, squaring the curve, I think it necessitates that we don't focus just on longevity, we focus on health span. And the reason why that is critical is not only because it's the right thing to do, it improves our quality of life, but because we need more productive years if more of us are going to live longer. So, I mean, what would be a catastrophe is if we get people living to be 105, but we still have just as few kind of productive years where we can be cognitively effective at our jobs or in the workforce. And so every country, I'm sure, will tackle this differently. They have different cultural norms around retirement, around how long people work. There's, you know, but in general, if we can't help people be cognitively effective and productive, you know, into their 70s, into their 80s, then I think the social security system will be very challenged because you won't have as many people paying into social security as those that are requiring it. So I think as we think through this, it's the right thing to do, but also ultimately, you know, if we can be very effective cognitively at 70, 80 years old, you know, we can do a lot more for the economy as well.
Yeah, this is something to reflect upon. Yeah. I don't know if the audience, there is any question. Yes, question here.
Thank you very much, and thank you all the speakers for the interesting interventions. A question from the colleague from McKinsey. You are referring to this need that we will have to extend, let's say, the productivity of people, with taking into account that we are going to live more, but we won't be probably having social security, so we'll have to find other ways in that sense to also to extend our, let's say, working life. My question in that sense is that if we are supposed to extend our productivity throughout our lives, that means that we'll have to take a better care of ourselves. So, I mean, let's say make a simulation like a car, no? If you want to a car to live or to live quite many years, you will have to, of course, to clean it, to give to the car good petrol, and to make it to travel for the correct distances. So I'm referring to, with regard to people, to have good food and to do exercise, and so on and so forth. My question in that sense is if McKinsey has made some kind of a study with regard to the trends of certain companies to take kind of care that the employees are doing appropriate, let's say, physical exercise or the physical movement during their working days, the same as, for example, with nutrition, because taking into account that in our lives, probably we spend, I don't know if maybe it's 40% of our lives working. In that sense, it means that it's the times when, during which we are able maybe to have more time to do this kind of small pauses for doing some kind of exercise or to take care of this, this issue related to nutrition. Thank you.
Thank you. And I think just connecting it to your point of the 9 to Thrive work we do with employers, your point is exactly right. If we're going to live longer, and therefore we need to be more productive longer, it almost necessitates that we have a relationship with our employment, our career, that is sustainable and healthy, right? We can't be operating at 99% our capacity, burnt out all the time, feeling that it's unsustainable with our family life, with everything, if we're meant to be doing it for a decade and a half longer, right? And I think that as an early indicator, you know, a lot of what I spend my time is actually looking at different services that different employers are kind of buying to help improve the performance of their employees, both on physical health and mental health. And what's interesting when we think of, we were talking about, like, it's important to measure the value. For a lot of employers, when they'll offer sometimes on-site clinics, they'll have like a primary care physician or nurse come kind of a few times a week in certain cases. They'll have these online services. If you actually run the numbers on the medical cost savings relative to the cost of that, sometimes they actually don't break even. But if you're the employer, what they look at beyond those things is they say, has it reduced absenteeism? They say, so, you know, are my employer and my employees showing up more? Has it improved their productivity in the time that they are there? Is it improving the retention rate of the employees? So I think already in a lot of the conversations of how employers think about, you know, should I offer some of these mental health packages? Should I offer some of these benefits? Should I offer some of these physical health benefits or kind of some fitness, wellness services? They're not really thinking of it just as a medical cost savings. They're typically seeing the value in improved productivity, reduced absenteeism, and improved retention. And so I think we're starting to see that already, but I think it has to be exponentially better over the next couple of decades if folks are meant to be, you know, working much, much longer.
Michael, and you have data on this.
What's that?
You have data on this.
I need to see if we've published data on this. I can't say for certain, but I would say in many of my travels with clients that sell solutions to employers, I've very much seen this.